Management of poison, principles of management of poisoning. First, immediate resistive measures. Remove the patient from poisonous environment. Removal from scene of fire in acute carbon monoxide poisoning. Memory aid, that is ABCD. First of all, airway assessment, assess protective reflexes. Monitor oxygen saturation continuously if inadequate. Open up and clear airway of secretions, vomit, endotracheal intubation, tracheostomy if necessary. Protective reflexes are Bing reflexes, gag reflexes, swallowing reflexes, sneezing reflexes, withdrawal reflexes, endotracheal intubation, tracheostomy. Breathing. Assessment by noting there is adequate tidal volume, perform arterial blood gas analysis, perform capnography, monitor the partial pressure of carbon dioxide or end-tidal carbon dioxide concentration. It is CO2 if inadequate, supplement oxygen therapy. By a mask or endotracheal intubation, maintain tidal volume at 10 to 15 milliliter per kilogram. Then next is ABC, that is circulation assessment by noting there is an assessment check for presence of pulses, absence of radial, femoral, carotid pulses, start continuous cardiac monitoring, 12 lead ECG if inadequate, secure IV access, IV fluid administration, cardiac antidysarrhythmic therapy, vasoactive agents, atropine, sodium bicarbonate, magnesium, then CPR compression. Then is depression of a CNS, turn unconscious patient to one side, prevents a tongue blocking, the throat allows fluid to gravitate out. Depression of a CNS is best evaluated according to GCS Glasgow Coma Scale or Matthew Lawson Scale. C pupillary size. Reactivity, D for stand for decontamination, ocular, that is copious saline lavage, skin as copious copious water, then soap and water, GIT, emesis, lavage. Dextrose, disability, dialysis, evaluation of drug, and additional mnemonic, DFG. This is, don't forget the glucose also. This is in addition to another. Next is Glasgow Coma Scale. Best eye response, there is first is no eye opening, that is grade 2, 1. Eye opening, respond to pain, that is 2. Eye opening to speech, 3. Eye opening spontaneously, that is 4. Best verbal responses, no verbal responses. Incomprehensible sounds, moaning, inappropriate words, confused, oriented. Best motor responses, no motor responses, extension to pain, decerebral rigidity, abnormal flexion to pain, decorticate rigidity, flexion withdrawal to pain, localizes to pain, obeys commands. Interpretation, GC7, that is E1 V3 M3 at 1040 poisoning classified as a severe, less than 8 is severe. Typically in patient with this score from any cause are considered in coma. Moderate 9 to 12, DCS more than 13 is minor. Next is Matthew Lawson Scale of a determined severity of a coma. Grade 0, that is fully conscious, alert. 1 drowsy but responding to verbal commands. Grade 2 maximum response to minimum. Pinching earlobe, painful stimuli. Grade 3 minimum response to maximum, sternal rub, painful stimuli. Grade 4 no response to painful stimuli, loss of all reflexes including corneal, pharyngeal reflexes. Evaluation of patients. Not an immediate resistive measure. It should be done as the patient is stabilized. Breath sound, auscultate and reauscultate, particularly after IV fluid has been given helps to diagnose pulmonary edema, acute lung injury, and aspiration pneumonia if crackles and rhongia are present. If coupled with abnormal breath odor or such as in a hydrocarbon, it may point to pulmonary etiology rather than cardiac etiology. Abnormal blood sound, that is point to pulmonary etiology, abnormal blood sound, hydrocarbon. Heart sounds a murmur in a injection drug abuse, especially when accompanied by a fever, indicate bacterial endocarditis. That is murmur, drug abuses, bacterial dysarthmia, such as overdoses of cardiac poison, digoxin beta adrenergic antagonist, abnormal abdominal examination, enlarged liver, hepatic toxicity, poison, chronic alcoholism. Bowel sounds to diagnose or exclude cholinergic diagnose as cholinergic and anticholinergic toxic helps to decide if purgative will be useful. Lack of bowel sounds, anticholinergic poisoning, purgative may not be very useful. Elimination of examination extremities, stands for elimination of poison, ECG, and exposing cases of toxic gases. Other measures, additional for memory, manage poisoning. There are not necessarily military measure F, that is fluid management, G, vital signs, gastric lavage, head to examination. Imaging, radiopaque poisoning, intervention, inspect back jaundice, attend for hepatotoxic poison, kidney failure, attend laboratory test, magnesium hydroxide, cathartic narcosis, attend to observe oxygen pulse. Most patient, whether unconscious or conscious, would recover by this measures alone. These methods were first used by Scandinavian physician in mid-1914 barbiturate poisoning with dramatic success. Looking after the ABCD is now also known as Scandinavian method of treatment, especially in barbiturate. Shift a patient to a proper environment, a dark and quiet room. Because of photophobia, datura, methyl alcohol, because of hyperexcitability to light and sound, strychnine. Thank you.